How do I know if I have a yeast infection? And I get questions from my dermatology patients asking me about the important topic of vulvovaginal candidiasis. And I wanted to make sure I give them correct information. So Dr. Baptista, who is a gynecologist and expert in the field, agreed to help me make sure that I'm right when I talk to my patients. So I have a series of questions that patients have asked me. So Dr. Baptista, how do I know if I have a yeast infection?
Well, thank you for the introduction, and I'm absolutely sure that you are giving the absolutely correct advice to your patients. I have no doubt on that. Well, as we know, at least 3 out of 4 women will develop at least one episode of candidiasis during their lifetime. And then we struggle with the issue that almost always when a woman complains of itching, it's often assumed both by patients and unfortunately also by physicians and healthcare professionals in general that it is candida. It is not true. Some of the times it is correct, but a lot of times it is not correct, and that's a really important issue that we should always keep in mind. One thing we must distinguish is that we should not be worried in women who are asymptomatic and, for instance, they have a pap test sample collected and it returns positive for candida. It just should be ignored. When women are symptomatic, the most typical presentations is itching and discharge, but alone by just if a woman calls us or shows in our office saying that she has itching and discharge, we may be right if we assume it is candida, but that's not what we should be doing.
Okay. Yeah, I've seen series of patients who don't have candida who've been treated for candida for several years. So I agree with you. It's really important. I'm glad to hear that I can ignore those candida on test if I don't suspect it, like although I don't do pap smears. So, patients often ask me, so, okay, what do I do if I think I have a yeast infection? Do I have to come in for an appointment? Do I have to call my gynecologist?
Well, I think definitely you should be a woman who is complaining or with a suspected candidiasis. She should be seen by an healthcare professional, and definitely some tests should be done. We should not just treat it based on the symptoms, as at least half of the time we will be wrong. Obviously, we've all committed that sin of having a patient calling, we are out of office, we are on holiday, and we'll say, okay, try an antifungal. We cannot obviously say it is acceptable, but I think we've all done that before. And if we can do it in a woman who has one single episode in which it is not frequent, in which it is not common, when they become to have several episodes, when after treatment she does not respond well, definitely there we need to do exams. Ideally, all women with vulvovaginal symptoms, women in whom vaginitis is suspected, wet mount microscopy should be done in office by a provider. And if the symptoms are long-standing, if it is recurrent, chronic, we need cultures to be sure of the species, and it also helps us confirm some cases in which we don't see candida under the microscope. Sometimes it will grow on culture. So in the future it might be changing with the rise of molecular tests, which are not widely available and still are expensive despite working well, but definitely we need an accurate diagnosis.
Okay. So I get another question often, because women are often worried about having clean genitals, whatever that means to them. And so I have people wondering, well, do I need to wash more if I have a yeast infection? I'm only washing once a day. Is that not enough?
I think that's a constant fight, not only for gynecologists, but definitely also in dermatology offices. I think we get more trouble of women washing too much, using abrasive soaps and all that. So definitely candida is not an issue of insufficient hygiene. At most, some women and we have quite typical women with bacterial vaginosis, which is actually the most common form of vaginitis, in which they tend to be bothered by the smell and then tend to wash even more and to use different kinds of soaps. And in the end, they might not only have their initial issue, but also developing skin problems due to the excessive cleaning. So I don't think at all that insufficient hygiene is a problem in Candida.
Yeah, I agree with you. The problem is usually too much hygiene that causes the secondary problem. So another question I get is, did I get this from having sex with my boyfriend or my husband? And can I have sex if I feel like it? I'm in this relationship, am I going to give this to my boyfriend or husband or partner? So what do you tell people?
Well, Candidiasis is not a sexually transmitted infection, but sex can actually be a trigger in some women for the development of symptoms. It does not at all mean that it is transmitted. A partner may get symptoms if having intercourse with a woman with Candidiasis. It usually is something that will just go away even without treatment. It's not dangerous for the partner. The women can, during an acute episode or chronic episode of Candidiasis, they have no serious complications from having intercourse while having an episode of Candidiasis, but it may hurt, it might be discomfortable. So I think that's what should really lead to a decision whether or not to engage in intercourse, is whether the woman is uncomfortable or not. But she will not develop problems from having intercourse, except from the discomfort.
Okay, so I can reassure them it's safe if it's comfortable for them.
Yeah.
That's good to know. And then how they want to know, so what's the best treatment? Should I, are topical treatments the best or oral treatments?
Well, it's a personal choice. When we go and see the efficacy of topical and oral preparations for the treatment of Candidiasis, the efficacy is the same. So it should be most of the times a personal choice. Some women will prefer to apply directly where they feel discomfort. Some women do not like to apply medication to their genitals and they will prefer an oral solution. So it basically is a matter of option, and that's one thing we tend not to discuss too much with patients. My personal perspective is that we tend to decide for the patient, but probably should be asking, do you prefer? We have both topical and oral regimens that both work. Which one do you prefer? The exception might be during pregnancy, in which we will always prefer to use topical medication.
Okay, so I hear you saying that they're equally effective. Is that correct?
Yes, and when we are talking about the most common causes of Candidiasis, when we are talking about Candida albicans, when we are talking about other species, things may change. It might be a different scenario.
Okay, and then another question I get a lot, or our patients will suggest to me, well, I'm doing this so I don't get Candida again, and I'm doing this. And so what should I advise, and what is there evidence for that helps with prevention? What can I tell people that may be effective?
Well, that's the toughest question you asked so far. When we go into the books, it seems an easy thing. You see a list of risk factors and sometimes you just think, okay, we'll just cut all of these and the woman will be just fine. Unfortunately, that's not what happens most of the times. Some women seem to be very sensitive to sugar consumption. That's a small fraction of patients. In women with chronic or recurrent Candidiasis, I often tell them, okay, try stopping to reduce sugar the most you can. Mm-hmm. Try it for a couple of months. If it indeed makes a difference, keep doing it. Unfortunately, in most women, it will not change. They will keep having Candidiasis. One thing that we should consider is in terms of contraception. Some women using IUDs, some of them will improve if we remove the IUD. It's debatable whether or not we should start by removing the IUD or if we should treat with IUD. Usually I tend to try to treat first before considering removing the IUD. There's always, I see very often women who are struggling with chronic Candidiasis, with some providers tend to stop oral contraceptives. When we go into the literature, we don't find any evidence that it really makes a difference. So in practical terms, there's not much we can do, unfortunately.
Okay. Well, it's good to know because a lot of my patients, at least, have a lot of self-blame. And so they'll tell me, oh, if I only ate better, I wouldn't have this or that. So that's nice to be able to reassure people. You can try the sugar, but if it doesn't work, and you don't have to
Yeah.
feel responsible.
Some of these women, they are already feeling miserable. They have terrible
Yes.
quality of lives. And so if we keep adding restrictions and we are not improving, it doesn't make sense. And one thing we are seeing these days a lot is women spending a lot of money on probiotics and believing they are doing a really important thing. There's no evidence that it works, and in fact, it doesn't make much sense in candida. While probiotics, the concept makes sense. For instance, for bacterial vaginosis, when we talk about candidiasis, it really doesn't make sense, and we have no evidence that it works, and that usually is expensive.
Oh, that's very good for me to know because most of my patients are, of course, using lots of money on probiotics. So, Dr. Baptista, is there any other pieces of advice that I might miss that might be important for my patients to know?
No, I'd say we've covered most of the most common questions we get asked.
Well, thank you so much. I really appreciate you talking to me, and this is going to help me and other providers care for our patients.